Hello and welcome to this video on the role and use of menthol in various medications and similar. Menthol is a very common ingredient in things like throat lozenges, chest rub or vapour rub and similar products. Essentially, if you have the common cold or influenza, there's a good chance your over-the-counter remedy contains menthol. Mind you, so do some cigarettes, but these are less helpful for respiratory diseases than medications or similar remedies. Menthol is a compound that's going to be extracted from the oils of mentha, basically a group of mint plants. It can also be synthesized, and in many cases it's done so as a flavoring or fragrance and used in many products. Whether we're talking about the, let's say, naturally derived version or the synthesized version, it's the same thing. Chemically, there's no real difference. It is considered an organic compound, meaning it's got a carbon backbone to it. In fact, it's got carbon in it full stop. The combination of aromas from menthol that give the impression of an active ingredient and some of the obvious effect make menthol an appealing choice of addition when we're talking about remedies. The aroma is combined with the cooling effect of menthol, and people assume that because they can both smell something and feel something, it must be doing something more. Menthol itself actually is something of a Trojan horse, let's say. It doesn't actually lower body temperature. What it does is it stimulates the body's thermoreceptors, the nerves in your body that are intended to understand what the environment's temperature is. And that then tells the brain, hey, the body's cooling down, even if it's not. Lozenges that have menthol provide this soothing effect and some of the cooling effect through this process, and also through the reduction of inflammation we'll get to later on. There is a certain catch to this, however. Under, let's say, laboratory conditions, low to moderate doses of menthol had the effect on those thermoreceptors, those nerves that are responsible for it, and that's how it gave the indicator of lowering the temperature. That's essentially that cooling sensation. However, if you gave higher concentrations, it actually had the paradoxical effect of amplifying the sensation of heat. This makes the first widely recognized effect of menthol a sort of lie. Not completely, but partially. It's a sort of a substitution trick. Technically speaking, if you think you're feeling cooler, you may feel more comfortable, even if your body isn't actually cooling down. The next we have is the sensation of the opening of airways. That is one of the generally recognized features, although how much of this is true is another question. If you were to look into menthol, you would find most people say it opens your airways and helps you breathe more easily. This isn't exactly the case, and it particularly isn't going to be very helpful if you're, say, feeling congested. There is, however, a certain truth to it, and that is, again, that mind over the matter scenario, the placebo effect. If you measure the effect, the actual change in nasal airway resistance doesn't go down. However, if you expose people to the aromatic effect of menthol, that is that they smell it, they believe that the effect is there, which, depending on how this works, may have an effect on then recovery through helping people improve their rest, typically speaking about sleep here. The other noteworthy effect is that, because it's primarily an aromatic, it's well tolerated, so even if people want to apply it again and again, it doesn't have any major negative effects, which will help to a certain extent in continuing to amplify that placebo effect, or that psychosomatic effect, if you will. If you take healthy individuals and give them the same active ingredient, menthol, there is no particular effect on the airway resistance. That is, it doesn't matter how you measure it, it doesn't change anything for healthy people, which you would think if it was acting on some sort of physiological or anatomical function, that is, for example, a receptor, like it does with the thermoreceptors, it would be able to find them in a healthy person, but it just doesn't do it. And this is true even if you take it by itself or you combine it with other active ingredients. For example, eucalyptus oil is one of the more common inclusions for this sort of thing. What it will do, at least according to several studies involving simulating this, is reduce the rate at which you cough, which may again have an effect on your ability to rest and recover. If you're trying to sleep and you can't sleep because you're constantly trying to cough, that's obviously not going to be great for your recovery. However, if you can reduce the frequency and seriousness of the coughing fits you have, that would help with your recovery. One of the things that the menthol can do, and this is one of the areas it's a little more difficult to explain, so bear with us, is that there are certain ion channels on your nerves. It would appear that menthol has a significant effect on these, and it helps with depolarizing these neurons. Now, the importance of this is that when you have a depolarized neuron, it's able to send a transmission along the axon of the neuron and then send it to the next neuron. If, as the research would indicate, what you have is that you essentially activate the neuron initially, but then you prevent the neuron from continuing to activate after that. You essentially have it run out of its ability to do something. It's kind of like driving a rental car until the gas tank is completely empty and then returning it. You've gotten the maximum use out of it, but it can't go any further for you. Admittedly, you don't get massive and ridiculous fees for doing so with menthol, but that's the difference in a very crass analogy. Menthol is shown to have this effect on a dose-dependent relationship. Let's say, more of this you use, the diminishing return you will get. Now, the effect of this is on pain specifically, and that is where the cooling effect is able to keep going, but the sensation of discomfort goes down. That's one of the reasons why I say lozenges are so useful. In short and simple terms, menthol essentially overrides the ability of pain receptors to work by making them use up all of their ability to signal and transmit pain. Then we have the anti-inflammatory, or as it's described, pro-inflammatory cytokines that are related to inflammation that are affected by menthol. It would appear that menthol is, let's say, able to interfere with both some of the inflammation process and the damage associated with that, but also protect against the longer running inflammation from, say, infection with something viral. And that would appear to be some of the reason why, for example, swelling goes down to an extent with menthol, particularly in this case talking about something like lozenges, where you are both directly applying it in terms of your throat, but also somewhat systemically after the fact. Another effect of menthol is that, to an extent, the more of it you consume, the more it will, to a certain extent, alter blood flow. There is a general association that the more menthol you have available for the area that's been inflamed, the more the blood vessels will dilate, and this is particularly relevant to the skin, less so to your throat. Your throat and mouth relationship is slightly different again, we'll get to that in a moment. But let's say you apply a rub to your chest. This helps with the air traveling across from it and carrying away the extra heat. This helps to an extent with, say, fever, and therefore it helps you to feel cooler on top of the menthol effect. Further to that, that effect is notable, typically speaking, on higher temperatures, so primarily when you have a fever. But in terms of your throat itself, for example, if you're taking a lozenge, it's a bit different because the blood flow will change more in response to, say, the sugars in the lozenge, rather than the menthol itself. And it's because your mouth recognizes there is something sugary in here because you have certain receptors to sugar in your mouth that have been activated by the sugar dissolved in your saliva. And therefore you produce more saliva to make up for that and to dissolve it more effectively. Coming back to the pain point, the pain effect, to be clear about it, is not huge. It does happen, let's be clear about it. But we want to temper your hope that this will solve all your problems. You are still better off taking something like, say, acetaminophen or ibuprofen to help with the pain. But this will reduce it somewhat. Understand, it's not a huge reduction. We're talking fractions of a percentage, typically speaking. somewhere between say 0.5% and maybe 1.5%, and this is nearly always in topical experiments. So the actual benefit may be say less than a 1% change in the scale of pain. Finally, we have nociceptor desensitization. So it's how you actually get this effect, and we've largely gone over this, but it's important to remember that you will to a certain extent have different receptors located in different places, and these will in different ways detect pain. So whether we're talking about say cold being one of the effects, this could theoretically be perceived as pain, but because you're already feverish, any activation of these receptors is considered, at least by the brain and how you've learnt over time, as a relief because you no longer feel fever. On the other hand, activation of other receptors could be, say, perceived as a more burning sensation. A lot of this part of the function isn't actually based on where you apply it, at least not locally. Rather, it's how your central nervous system, for the most part here your brain, interprets the combination of all the various signals that are coming back in. In short, some of them are saying, yeah, this is painful and uncomfortable. Others are saying, well, yeah, this is painful and uncomfortable, but the brain goes, I'm getting this signal that says painful and uncomfortable for a hot reason, and this signal that's saying painful and uncomfortable for a cold reason, therefore they somewhat counter out. Something like multiplying a negative by a negative gives you a positive. As you can see, menthol isn't exactly what you think. Sure, it can provide some benefit, but how much will vary by person, and to some extent the type of symptoms you're trying to address. Some of them will be rather comforting, others not so much, and in some cases, the overwhelming smell of menthol may just be too much for you to rest effectively, which is the primary benefit of menthol. That is, it allows you to rest and therefore recover much sooner, which is really the only treatment to things like the common cold and influenza, rest and fluids. If this helps you rest, you will recover sooner, and in some cases it may or may not help you with consuming fluids. But for the most part, it has limited benefit, but it does have some benefit. Thank you for watching this video. If you found it interesting, consider liking, sharing, and subscribing. And please do post any comments, questions, or suggestions you have below.